All right, shifting tracks now, and let's also tell you about the deadly Nipah virus outbreak in Kerala that has already claimed 6 lives. And according to the latest information coming in, 2 more deaths have been reported from the isolation ward in Kozhikode Medical College. A central medical team has arrived in Kerala to conduct field visits in the affected areas. The deaths have occurred in Kozhikode and in Malappuram districts. The outbreak of the disease has obviously created much panic and fear among the people. That's because the Nipah virus has first been identified among humans all the way in 2004 in Bangladesh, and according to reports and information, it can be transmitted to humans through contaminated water, fruits or direct contact with the affected person. Now, the Kerala Health Ministry has said that the virus is spreading through direct contact. Now, this is a worrying bit of news, that the virus is spreading through touch or contact of body fluids, and precautionary measures are also being taken.
One thing that we have to fear, that this is a dreaded disease. That means the case fatality rate may be as high as 70%. But as an average, we experience a case fatality rate of 70%. That means out of 100 infected, 70 people may die. One thing that is positive is the chance of getting a Nipah infection is actually very, very rare. As of now, we do not have a perfect treatment for this disease, but we can support the patient so that the patient, the death rate can be reduced.
2001 में पहले भी आ चुका है। सिलीगुड़ी के अंदर में इसका लोकल आउटब्रेक हुआ था। बांग्लादेश में ये केसेस होते रहते हैं, मलेशिया में ये केस होते रहते हैं, वेस्ट बंगाल में ये केस होते रहते हैं। और ये एक दिमागी बुखार है जिसे एन्सेफेलाइटिस बोलते हैं। इंडिया में जो 2 एन्सेफेलाइटिस कॉमन है वो जैपनीज एन्सेफेलाइटिस है और हर्पिस सिम्प्लेक्स एन्सेफेलाइटिस है। लेकिन ये तीसरा एन्सेफेलाइटिस है जो कि अभी ये फोकल है। क्योंकि ये ह्यूमन टू ह्यूमन ट्रांसमिशन होता है, इसमें प्रिकॉशंस की ज़रूरत है। ज़्यादातर वैक्सीन्स किसी भी वायरस की, बहुत कम वायरस एन्सेफेलाइटिस की वैक्सीन्स हैं। इसकी वैक्सीन्स अभी आज की डेट में नहीं है। इसी के सिमिलर वायरस की एक वैक्सीन ऑस्ट्रेलिया में है, इंडिया में अभी इसकी वैक्सीन अवेलेबल नहीं है।
दिस इज क्वाइट अ डेंजरस वायरस इन द सेंस दैट इट अफेक्ट्स द ब्रेन and all the symptoms which sometimes include headaches, vomiting, drowsiness and sometimes brain fever. So these symptoms can be life-threatening also. There are some vaccines like ribavirin vaccines which may have some role because they treat a lot of other viral illnesses, but you can say definitive vaccine or tablet is not available. But yes, universal precaution if taken properly, and we give adequate supportive care to all the affected patients.
Gopi Krishnan Onithan joins us for more. Gopi, it's understandable that the first outbreak of Nipah virus in Kerala has caused large-scale panic in the state. But give us an update. Tell us about the medical team that has been flown in to assess the situation. Give us a sense of, the preventive measures that the state government and the hospitals are taking.
Well, Avantika, the actual preventive measures that can be taken at the moment is to create awareness among the people, because initially the people did not really know about the extent and the actual concerns of this particular virus. And it was only after that, after the people realized that this is a Nipah virus which is really, really dangerous, and in fact the mortality rate of this particular virus is 70% is what we have been told by the medical expert. That means 70, if a person is infected by this particular virus, it's highly probable that he could die. That is 70% will be the probability of that particular guy dying, and it's actually transmitted through direct contact between human beings, or it could be carried by the bats. Fruit bats is what the experts are telling us. So now the awareness has to be created among the people, and mostly in the particular Perambra village in Kozhikode, where this virus has been first noticed, and after that in nearby areas also there must be awareness has been created, is what the health department is telling us. And they have now flown in a special team from Delhi. The AIMS team will reach Kerala very soon, and they will have a meeting with the state health minister, and they will also have a field visit at this Perambra village, is what we have been told, Avantika.
All right, Gopi, thank you so much for that information, and we'll keep coming back to you for any further updates. But for now, thanks so much. Moving on now.